Is it actually possible to get an eyebrow lift while simultaneously correcting your forehead lines? Before we begin, my name is Dan Julian, nurse practitioner and board certified medical aesthetics provider. Our clinic is located in Ottawa, Canada, and I collaborate with all the top medical aesthetics providers in the world to provide you with the most up-to-date information possible. Time and time again, clients come in and they state, hey, by the way, I'd like to treat these forehead wrinkles, and I'd also like to make sure that I get a nice arch in my eyebrow. Can you do that for me? And that's where we have to go into this big conversation of the consultation to explain these anti-wrinkle medications relax muscles. And the reason why we have these wrinkles here is because we raise or contract these muscles right here, causing these horizontal lines, right? So if we are placing medication here, it's going to relax it and actually do the opposite of what you're hoping for, potentially dropping the eyebrows. Now, this isn't saying that it's impossible to achieve this. It's just that realistically, there's only a small set of the population that might be able to achieve it, and most of the population probably won't be able to achieve it. So just a reminder, we are talking about the horizontal lines here. That happens from the opposite movement of a muscle. So we have movement going up and down here. And when I say up and down, well, believe it or not, these two muscle groups, which are the frontalis, actually do two different types of movements. So the line of convergence came up in about 2020 whenever there was a study out stating that the frontalis muscles have bidirectional movement. Anything under the C-line moves up whenever it's flexed, and anything above the C-line moves down whenever it's flexed. Once you get that, then you realize that anything placed up here, for the most part, won't drop the eyebrows, because if this part's relaxed, it's only going to maybe do nothing or move back, but it shouldn't drop anything for most of your clients. And I think what's important to understand about the C-line is that this is a guide. Most people, if you inject above the C-line, will not have a drop. However, a lot of things play into factor, especially age. Usually whenever you start getting to 60, 65 and over, whenever you start placing neuromodulator, even a little bit up here, it tends to make everything heavy. But for most of your population who's going to come in and get neuromodulators, placing anything up here is considered safe. All right, so how do we kick up the eyebrows while placing neuromodulators on the forehead? Well, this is really going to come down to the certain population that comes to see you. If you have clients that basically have wrinkles mostly up here, then all you have to do is inject above the C-line. It's going to relax the wrinkles, and at the same time, it's going to relax this part, which when it's flexed, it's moved forward. So if it relaxes, it's moving back. So it's going to give you the best chance of getting some type of lift while relaxing a lot of those wrinkles. All right, so what about the rest of the population who have wrinkles below and above the C-line? Well, this is your hack, and this is basically the trick that you can do. You can essentially relax the medial or inside parts of these frontalis muscles. Notice how I divided this muscle in half, and I divided this muscle in half with a faint line here and here. You want to place some of your toxin here and here, and therefore this part's not going to move or move as much. And then after that, it will allow the lateral part of the eyebrow to move. And it'll actually compensate, and it's going to pull up oh so slightly even at rest for some of your clients. The concern here is that if you just leave it as is that way, you're definitely going to have a Spock brow. The Spock brow is where nothing moves, and whenever they raise their eyebrows, they get this little weird point right there on each side, and it doesn't look natural. So in order to kind of help that, you have to soften some of the wrinkles, but not necessarily get rid of all of them. And you'll also have to stay really high. So essentially what you want to do is place a little bit of neuromodulator up here. And then also what you can do is place it on the C-line right at the intersection of the temple crest, which will allow the dispersion of your neuromodulator to hit some of the lower part and some of the higher part. Your dosage is going to range widely based on who's coming to see you. If they're younger, if they're more mature, if they have hooded eyelids, size of their forehead. This is just a guide in order to give you some type of tip on how to give some type of lift. So can you treat all of the wrinkles while getting a chemical eyebrow lift? Maybe for certain clients if they really only have wrinkles up above. But for most of the population, if they have generalized wrinkling here and they're looking for a lift, well, the lower you go, especially below the C-line, the higher the chance that the eyebrow is actually either going to stay in the position or even drop. Tricky stuff, right? Now remember, things will also change over time for you. So if you were able to have an eyebrow lift at one point because you were younger, well, don't assume that that's going to happen all your life. As you mature, typically this frontalis muscle tends to move, and as it moves more or drops with time, the less likely you're going to be able to achieve this lift. So that's it for me, guys. If you enjoy this type of content and you want to see more on live clients, then consider joining my Patreon, where it's designed for serious medical aesthetics providers. just like you. Till the next time, take care of yourselves, exercise daily, and please be nice to absolutely everyone. Cheers!